The traditions and rituals of nursing are vital to its image and to its stability. Nurses value their origins. They want to know more of their history. Scholars of women and their work, labor historians, and medical historians all meet together at the Barbara Bates Center to debate and create new directions for research and scholarship. Our center has one of the largest accessible collections of documents and images across the country. It started in 1985 with Joan Linaw, Ellen Baer, and Karen Buehler-Wilkerson, and they initially collected the documents from the Pennsylvania General Hospital and the Hospital of the University of Pennsylvania to bring those documents together and when they were in the process of closing. We also now, of course, have the University of Pennsylvania School of Nursing documents, and we have documents from other schools of nursing in the area, whether it be from Mercy Douglas Hospital School of Nursing, which was in operation until recently, I can't remember exactly, the 60s. This was a school of nursing for the African Americans. We also have recently obtained the documents from Episcopal School of Nursing. This school has recently closed. I believe they had their last school of nursing this past year. We have now obtained their documents and their photographs. We have a large number of documents from the Visiting Nurses Association. We have documents from professional nurses associations and organizations, and we have individual scholars' papers. Linda Aiken, who is still with us at the University of Pennsylvania. We have Claire Fagan's documents. We also have Lillian Bruner's documents, Rosella Schlockfeld. I am not from the University of Pennsylvania, but I've heard of these women all of my life, all my professional career. So it's wonderful to be able to see their documents. I want to invite all of you over after the presentation. I understand there's going to be a tour of the building. Please come to 2U, which is where our center is located, and we have a display of some of these documents for you. We have Claire Fagan's papers and documents that she used for some of her publications, some of her note cards. Before, some of you all remember this, I'm sure, before we had computers, we all had to do note cards to do our dissertations and our theses. Well, we have Claire Fagan's. So, but we have other documents too. We want to share all that with you. So we invite you over afterwards to come to our center. We also have seminars, weekly seminars. Dr. Jean Whalen is here. She's one of our foremost historians also in our center. We're committed to disseminating research through publications and interdisciplinary sharing and collaboration. We support historical scholarship on many levels, including that of doctoral students. And that's where I want to come now to introduce Amanda Mahoney. Amanda is one of our stars. Amanda is a doctoral student here at the University of Pennsylvania. The University of Pennsylvania has a track where students can get a PhD in nursing history. It's very unusual to do that. There are other schools that will focus on nursing history, but they can't get a PhD that focuses specifically on nursing history. And our school has that. Amanda is in that track. She is also one of our second degree students. I call her a hybrid, like a lot of us in nursing history. She has her first degree, was a Bachelor of Arts in both chemistry and art history. And then she was a second degree student in our nursing baccalaureate program. So she comes with many, many different strengths. She is, when she graduated, she went over to the University of Pennsylvania and to the University of Pennsylvania Hospital, I have to get all these names straight, where she was an oncology nurse. So that she's skilled not only in the humanities area, but she also is a very skilled nurse scientist. She does chemotherapy. She does protocols. She has administered lots and lots of different medications. She has also served in many different museums. So she's a scientist, but she's also a scholar in art history and in museum work. And that's what she's going to be bringing with us today. She's worked at the Museum of Archaeology and Anthropology, the Brandywine River Museum. She's going to be talking today. She knows more about art history than I've ever heard anyone know. And she just took me on a tour of the building and pointed out the many wonderful history pieces that are in this very building. So with no further words, I'd like to introduce Amanda Mahoney.
Thanks, Dr. Wall, and thank you for having the patience of going through the tour of the Morgan Building with me. Thank you all for coming. I'm going to talk about the Agnew Clinic, which is a painting owned by the university that is usually housed in the Philadelphia Museum of Art. Unfortunately, the real painting is not on display right now in the museum because it's being conserved. I'm going to talk about the painting, what that painting means for Penn, some of the motivations behind the creation of the Agnew Clinic, and also the nurse who's featured in the painting. So do we have any HUP alumni here today? Excellent, thank you for coming. Please feel free to tell me afterwards if I get some of my dates wrong, okay? So here we have the seal of the Hospital Training School of the Hospital of the University of Pennsylvania, which was founded in 1886. I've gotten a few slides here from the university archives that show some of the older hospital buildings and the nursing residence. Here is the first graduate of the HUP Training School for Nurses, Mary Burns. Let's all take a nice deep breath on Mary's behalf. Look at that waist. Now, for those of you who are not nurses, you're still very welcome. But to fill you in a little bit on what hospitals were like and what training schools were like prior to the modern age, the nursing students lived at a hospital. They lived at the university hospital, and they were the primary workforce in the hospital. You can see here there's a mix of, I'm going to try the laser pointer. There's a mix of student nurses of various levels and a supervising nurse. And some of our nursing and med school alumni can tell you that the students ran the hospital during World War II. There was no one flying the plane, so to speak, besides the students. So that role has changed, though a lot of our undergraduates will tell you they work pretty hard in clinical. They're not the actual workforce. So here we have the Agnew Clinic. If you were fortunate enough to come in through the second floor, you saw the replica hanging over the doorway. It was painted in 1889 by Eakins, commissioned by the students of the medical school class of 1889 as a tribute to Dr. Agnew as he retired. That's Mary Clymer. The reason Mary Clymer is of interest to me especially is because she's played a very important role in the interpretation of the Agnew Clinic by art historians. And the History Center here at Penn is fortunate to own or be the custodians of some of her journals from 1887 to 1889 when she attended the training school. Here we have a portrait of Eakins. I did a little bit of work to try and find a picture where he was smiling and couldn't come up with one. He was a Philadelphia-based painter. He lived from 1844 to 1916. And while he was not quite so celebrated during his lifetime, he's widely accepted as one of the lions of American art, one of the first modern artists, and a very important player in the art world of the 19th and 20th century. Here we have one of Eakins' better known paintings. I can never pronounce this. It's like a tongue twister. Max Schmidt in a Single Skull from 1871. A very well-known art historian who was here at Penn, Elizabeth Johns, did a lot of work on Eakins. And she described him as the painter of the heroism of modern life. So while some of his contemporaries would paint a portrait of a man or paint a figure in a historical role, a battle, an allegorical scene, Eakins painted people participating in modern life. Typically men, we'll forgive him for that, but typically men participating in what Johns calls the heroism of modern life. Sports figures, physicians, lawmakers. To give you an idea of how both the technique and the subject of Eakins' work differed from the other artists working in the US at that time, I've picked two portraits here of Walt Whitman, which, can anyone guess why I picked Walt Whitman? He worked as a nurse during the Civil War. First looking at these paintings, you can see that the Eakins painting over here, I do like this laser pointer, thank you. The colors are a little bit warmer. There's some differences in the technique. But if you look at this portrait by John White Alexander, not only are the colors cooler, but I would say that Whitman looks a little more like Santa Claus. See how clean his beard is? And how, while you can accept that this is real human skin, it doesn't have the ruddiness and the texture that an older man who spent a lot of the time in the sun, that his skin would have. You hear people use the term warts and all. Eakins leaned a little more towards that style. Eakins was also one of the first artists to use photography in his work. He was fascinated with it. Here we have a photograph of Walt Whitman. And you can see, while Eakins' portrait is not an exact photographic reproduction, it's closer than John White Alexander's. Now, another one of Eakins' interests was the human form. He, along with Edward Muybridge, he took photographs of the nude in motion, the human form in motion, and was very interested with the nude form. There are some nude photographs of Walt Whitman, but I was afraid there would be children here, so I left those at home. So that was very controversial. There were certain realms of art where the nude was acceptable, where it was okay to have a naked person just hanging out in a field. You have a classical setting, an allegorical setting, it's okay. Now, I want you to look at this, look at the forms, and then look at a William Morris Hunt painting from a little bit earlier. I'm going to flip back. Can you see how Eakins has paid a little more attention to the muscles, the musculature, and the skin surface here? Whereas this looks much more like a ceramic figure. You know, it doesn't really seem like this person is naked. Now, some of this difference we can ascribe to technique. But I would say that Eakins had quite the emphasis on the nude form. So how does this tie into the Agnew Clinic? Well, by the time the Agnew Clinic was painted, Eakins had been fired from the Pennsylvania Academy of the Fine Arts after pushing the envelope a little too much. He was a little too focused on the nude for the likes of the administration. And at one point, he removed the loincloth of a male model to show a female student the way that the hip attached to the top of the leg. And after that, he was dismissed. He and his wife left Philadelphia, and his career had not reached the heights that he had hoped. And he was looking for a niche, looking for a way to feed his family and continue to work as an artist. So the Agnew Clinic was painted in 1889, as I mentioned, as a commission from the medical school, class of 1889, in honor of Dr. Agnew. The inscription on the frame of the portrait reads, D. Hayes Agnew, MD, the most experienced surgeon, the clearest writer and teacher, the most venerated and beloved man, 1889. Now, have any of our faculty ever gotten a review like that? So Agnew was much loved by his students. Now, it's very interesting. The students approached Eakins to do a simple portrait, and Eakins said, I'll do a portrait. I'll do it for the cost of a normal portrait, but I would like to do a big action scene, a big portrait of Agnew as a hero of modern life, as the modern surgeon. And in exchange for that bargain of a lifetime, the students agreed to pose for Eakins. Here we have Dr. Agnew lecturing to a group of students. To give you some background on Agnew, excuse me. He was on the faculty for almost 30 years here at Penn. He was an early adopter of anesthesia and aseptic technique. and he was an advocate for nurses, though he did not allow women in his medical school lectures. So he was an early adopter of a lot of surgical and medical technology, even though he was older when some of these trends came along. Let's look around here a little bit. It's difficult to see in the photograph, but here we have an ether cone and a can of ether. I actually think that this is a cadaver. I don't think this is an actual surgery, but we have no way of knowing. Here's a simple photograph of Agnew from the University Archives. Here's the painting hanging where the replica hangs now. It was painted to be hung in the medical school building. So the intended audience was people who would be in the medical school building. So file that fact away for me. Here we have what I think is the original medical school building. And I always get confused if it's Logan Hall or College Hall. If one of you are, it's Logan? Okay. I knew someone would know. So not only did the students pose for Eakins, but Agnew repeatedly came to Eakins' studio to pose. He gave Eakins a lot of feedback about the painting. And it's a little difficult to see, but there's more blood spattered on the apron and on his hands, and he looks a little gruff and serious. And Agnew didn't quite like that. He wanted less blood. He wanted to look a little more friendly. And I think he looks a little more warm and fuzzy there. And there, though it's really difficult to tell on a slide, there is less blood on his hands and the apron. Okay, so let's take a minute and look at the painting. Think about what it brings to your mind. What draws your eye in? What do you think's going on in here? So we know who just about everybody in this painting is. The 1889 alumni have done a wonderful job of, they seem to hang out together every year. And one of the things that they did was pose in pictures and write and reflect on their participation in this painting. Everyone is identified and numbered, including Mary Clymer, except for one figure. Can anyone spot who's not numbered or identified? Right, the patient. More on that later. Okay, so why would Eakins, who's struggling a little bit for money, struggling a little bit for fame and prestige, why would he give them this painting at a bargain basement price? And why would he paint this he could have, that portrait study is perfectly serviceable. It's a very nice portrait. Why did he want to make this big painting? Well, one reason is, if you notice as you came in, there are dozens of very nice portraits by a number of Eakins' compatriots. Vanna, White, even Sargent did portraits of medical men here. But they're pretty traditional. So this could get someone's attention, yes, this huge canvas that barely fits on a wall, yes. But there's another reason. How many of you have seen the Gross Clinic? Excellent. I believe it's still here on display on campus, and if I can plug another organization, the Penn Reading Project this year, the sort of freshman reading seminar, focused on the Gross Clinic. They have a wonderful website with links to lectures and other websites about the Gross Clinic, and a group of students did a sort of a viral video and song about the history of the Gross Clinic that really, you got to see it, it's very good. Okay, so this was painted in 1875 on spec for the Centennial Exposition, and it was rejected by the art committee for being not nice for ladies to look at. But of course, the medical community loved it, and it was included in the medical hall of the Centennial exhibition. So we're going to talk about the Gross Clinic in contrast to the Agnew Clinic, and how that may have influenced the creation of the Agnew Clinic. So what's going on here? This is Samuel Gross, who was a very well-known surgeon at Jefferson Medical College. an early correspondent of Semmelweis. He disputed germ theory, but adopted sterilizing his hands before surgery just in case. He is sort of the last well-known American surgeon of the era when surgeons were known for their speed more so than their skill, because of the rudimentary types of anesthesia that were available at the time and the type of surgical technology that was available at the time. So here, can someone guess what that anesthetic is being used there? It could be ether, but it's probably chloroform or a mixture of the two. And it's applied to a rag. It's not the cone that we see in the Agnew Clinic. Here we have the assistants are helping to hold the patient down. Okay. So what do you notice about the attire of the gentleman performing the operation? Aseptic technique, not really widely accepted in the 1870s. Here we have Agnew and his mostly pristine, though possibly somewhat sanitized for the painting, apron. But what are none of these people wearing? Ew, right? Yeah. Whenever I show this to undergraduates, they just can't believe it. Gross. We can also clearly identify the words University Hospital on what I would guess would be a lift sheet or a draw sheet underneath the painting. Or really, it almost looks like a chuck for those of you who are still practicing. What else? What do you see in the Agnew Clinic that you don't see in the Gross Clinic? The nurse. So what does all that mean? And all of you will pass your first exam if you take an American Art History undergraduate level course, because that is always an essay question. So what does all those fun facts mean for us when we look at the Agnew Clinic? Well, a very interesting art historian named Amy Warble, who has a very good book out about Eakins and his medical paintings, she has the idea that this is an advertisement for Penn. This is referencing the Gross Clinic. The students from 1889 probably asked Eakins to do this painting because they felt that their idol Agnew was on the same par as Gross, which, you know, he was. So he deserved to be painted by a man like Eakins. We can also think about who is going to see this painting. It was designed to hang in the medical building, right? So who's going to see it? Medical students, physicians, nursing students, nursing instructors, and potential medical students. So here we are showing all of the cool technology that we have here at Penn that we continue to advertise, right? On display, we have both the prestige of having medical men, having a history of brilliant medical minds like that of Agnew here at Penn. But we also have the super cool ether cone. We have aseptic technique, and we have nurses. Another technological advancement in the world of healthcare. The training school for nurses here at Penn started in 1886, and the best that I could find, the nursing school at Jefferson did not start until 1889 or 1890. So Penn was ahead of the curve yet again. So what else is going on in this painting that makes it so interesting to art historians? And why do we even know about Mary Clymer? Well, I can tell you, as Dr. Wall mentioned, much to my parents' joy, I went through a number of majors as an undergraduate. And art history was one of them. And Mary Clymer is all over the art history literature, especially the feminist art history literature about this painting. And why is that? Well, if we look at this image from a textbook of the same operation going on in the Agnew Clinic, there's something that's missing from this picture that's readily apparent in this picture. and that is the naked, healthy breast. This, I had a number of people tell me that they never identified this as a woman, but the patient is a woman, and the operation taking place here is a mastectomy. Now, one of the reasons that we know this is because it was an operation that Agnew performed regularly and that he wrote about often. Dr. Werbel has a couple of ideas that perhaps a mastectomy was an operation that was very marketable as a skill for new graduates, something that you wanted to have on your resume. So it was something that adds into this idea of the Agnew Clinic as a advertisement for Penn. So why did Eakins do that? And how do we know that the breast should be uncovered? The way that we know is from Mary Clymer. I will get back to that in just a second. This is a portrait from a French painting of Dr. Payan, who invented the... No? Okay. He invented surgical forceps clamps for stopping bleeding during operations. I didn't know that either. But you can see here, in this painting, this woman is topless for no reason. And looking at it, I think even if you were a French 19th century observer, that doesn't really make sense to me. Why is she topless? Doesn't quite seem appropriate. But here it doesn't really bother me so much. But I can tell you that when I was a 20-year-old art history student, it really bothered me. Didn't understand what was going on here. A number of art historians have proved that Eakins, or reasonably proved, that Eakins left the healthy, unaffected breast exposed on purpose. The reason that we know that is because in Mary Clymer's class notes from January 8th, 1889, she wrote, "Professor Ashurst on the duties of a nurse at surgical operations. Have clothing loose, and if necessary, cut out the sleeve. For a breast case, only put one arm in the nightdress, and be sure and have the one exposed that is to be operated upon." So we know that most likely in 1889, this healthy breast would have been under the nightgown. It would not have been exposed. So why did Eakins do that? Why are we treated to this extra little bit of flesh? Well, a number of different art historians have some different theories. Margaret Supley Smith, who is the first academic that used the Clymer diaries, she thinks it's a compositional device. It's a way to draw your eye to the viewer, and it's Eakins' excuse to have a female nude in one of his paintings. I can kind of buy that. Bridget Goodbody, who has more of a feminist interpretation of this, she sees a lot of gendered power in the medical establishment, the male medical gaze controlling the female patient. She sees a lot of control and patriarchy going on in this. And prior to becoming a medical professional, I saw that too. You have all of these men staring at this naked woman. Out of context, it can be a little bit disturbing. She backs up her claim by using Agnew's writings on mastectomies and his writings about women in medicine. And finally, Amy Werbel, the art historian who's done research on Eakins as a medical artist, she uses this excellent phrase. She calls the naked breast Eakins' trademark element of provocation. He's cluing in the viewer on what type of operation this is, but he's still being a little controversial, being a little edgy by having the naked breast there. So it's sort of a balanced interpretation. Now, the other role that Mary Clymer has played in this painting, apart from providing us with a wonderful source about what surgery was like in 1889 here at the university, is her role as a woman in this painting. And Margaret Supley Smith says, look at poor Mary Clymer. Who does she identify with in this painting? The only person she can identify with is the unconscious, half-naked, vulnerable patient. And again, as a 20-year-old, I said, oh, yeah, that's completely what I see in this painting. Who does she connect with? And I saw her gaze at the painting, at her face in the painting, as she's looking at the patient, pondering this huge question of gender identity and her role. Then I went back to school and became a nurse, dusted this off, looked at it again and thought, that's not what's going on here, right? Do we have any OR nurses or surgeons in the audience? Yeah? Yeah. Oh, hi. I would say she's doing her job, right? I wouldn't say that she necessarily feels out of place or that she's disconnected with anyone in the painting. I think she's looking at the patient because it's her job to watch the patient and to anticipate the needs of the surgical team. So while I can agree that there are some issues of gender and power going on in this painting, Mary's she's hanging out doing her job. She's not out of place there. So what else is interesting about Mary Clymer? And why should we continue to study her? Clymer graduated the top of her class in 1889, for which she was awarded the Nightingale Medal. This is a class picture of some of the medical students and nurses from 1889. I have blown up this picture, and I can't pick Mary out of it. But she could be in there, but this is some of her classmates. When Clymer graduated, she missed the graduation ceremony because she was busy helping flood victims in the Williamsport flood in Pennsylvania, part of the flooding that happened in north central Pennsylvania. Clymer also worked as a private duty nurse for many years. We tracked down a copy of the College of Physicians in Philadelphia of their nurse registry. Dr. Whalen and I dusted them off one day and found entries for Clymer. It was where it basically served as a registry office for nurses, where private patients and physicians could go and ask for a nurse who would help a patient recuperate at home. This was where the money was and where the jobs were for new grads. They did not really work in the hospitals, they worked in private duty. This is a photograph of Edith Covell working as a private duty nurse that I just threw in there for my fellow history buffs. I also found, I looked a little bit into Mary Clymer's biography, trying to figure out where she came from, who she was, why she became a nurse. And by using the Census Bureau data, I was convinced that she was a factory worker who lived in Germantown with her family of 12 before getting into HUP and becoming a nurse. And then I experienced a very strange and new sensation of discovering that I was completely wrong. But I'll get into that in a little bit. So Mary Clymer, after working for many years as a private duty nurse, married a somewhat prominent businessman, a man named George Baines, and as far as I could tell, stopped nursing. But what changed, she didn't really leave nursing though. She became very involved in the alumni group from HUP and in nursing organizations to regulate and promote the nursing profession. It was really interesting to find out that she got married because she started using her married name, and I was able to uncover a lot more information about her. So I want to talk a little bit about the diaries, which I hope are going to be out in the base center for everyone to see if you come on the tour. There are 3 notebooks. One is her class notebook. One is copied lecture notes that she handed in to be graded by her professors. And the third, which I find the most interesting, is almost like a quick clinical journal, like her clinical log from class, where she wrote about her experiences on the wards in the hospital. These are just some pretty bad reproductions of the actual diaries themselves. So why study Mary Clymer? Now, there's something to be said for studying history for history's sake, but from what I've been told, that doesn't really work on grant applications. We can also talk about, learning about nursing, what nursing can do, what we need to change about nursing through understanding our history, that could help us advance nursing now and better employ nurses now. I kind of buy that. But I'm going to tell you an anecdote that encouraged me to continue to study Mary Clymer and why I think studying individual nurses is important. So I originally presented this material as a senior at Penn to a group of other seniors, second-degree students and traditional students. And I thought I was going to show this painting and they were going to be completely fascinated by the Agnew Clinic and so impressed with my art history knowledge. But they weren't. They were much more interested in the contents of the diaries and how Clymer's story was both similar to their own and different. And while Clymer's journals are a tremendous factual resource for us, we can understand how operations were performed in 1889, but they also reflect some of the experience of nurses and nursing students. Clymer has one entry where she complains that she has to constantly watch one patient while her other patient needs the door shut because there's a draft, which I've had similar experiences myself. She also makes notes such as, didn't learn anything new today, or stayed in and worked hard while others went out. So it's a very rich resource, and I'm really hoping that we can continue to study it and learn more about Clymer. Now, I mentioned that I was wrong, and anyone who knows me can tell you that does not happen very often. I thought that Mary Clymer was typical of other students at HUP, that she came from a so-called working class background, that she worked in factories, that she may have worked as a seamstress, or even in domestic work, before deciding to take a step up in the world and become a nurse. But it turns out that I was wrong. I was wrong about, I misidentified Mary Clymer in the census records. And then with the help of a genealogist who was studying a different Mary Clymer, who was also a nurse, I discovered that Mary Clymer was the daughter of a Civil War veteran in a town called Yardsville in Mercer County, New Jersey, and that her family was kind of prominent. They have a very large plot that my research assistant and I looked through to find Clymer's grave out in Yardsville. Her family was relatively prominent, and she was older than most of her cohort. So there's a number she was 28 years old when she started nursing school. So there's a lot of mysteries to be solved about Clymer. I really hope that you'll be able to come to the Bates Center and see some of the great work that goes on there. I'd like to thank any of the HUP alumni who are here. They've done a wonderful job of preserving their history and have a tremendous resource that I hope to mine to learn more about Clymer. If you have any questions, I'll be here for a little bit, and thank you very much for your time and your attention.